Hi, so today I'm going to be talking about the drug policy in Switzerland and how they do harm reduction there in their specific country and the legislations they follow. So I'm going to briefly start off by talking about the 1900s. So during 1900, Zurich was consistently ranked one of the best places to live in the world. Financially, it was not always the best, considering now it's one of the most economically well countries. It wasn't as good during the 1900s, especially in the 1990s. In fact, there was 400,000 people openly selling drugs, and it was Europe's biggest open drug scene. And this is why Switzerland was known for its notorious behaviour around drugs. We're talking about serious drugs like heroin and cocaine and marijuana. And these days, there aren't as many heroin addicts in Switzerland, and we've seen a very major decline in the number of people taking heroin in the recent news. And that's what's so interesting about Switzerland. What did they do to combat the situation with drugs, and how did they do harm reduction in the country specifically? If we look at United States and Australia, they're also witnessing a major comeback with heroin, especially in the UK as well, with people from the ages 18 to 25 increasing the number of use of heroin and other drugs, especially ketamine. So when we're talking about the 1990s, there were major problems in the park, and there was a specific park in Switzerland, which was in Zurich, and this was prevalent with heroin. There was a lot of violence, HIV spread amongst users, and prostitution. So these are the crimes related with drugs, and there was a number of deaths related to drugs in Switzerland between 1975 and 1992. And that's why it's so interesting to talk about Switzerland as being one of the most major change in countries with the drug policy. So if we look at it in the terms of the liberal approach, the approach that they took initially, and I think they're still trying to use it now, is using therapy and treatment. So instead of criminalising addicts like the UK does with a lot of drug users, there's new policies aimed to reintegrate them back into society. They're trying to help those users to try fit back into society as they should be able to. For example, in 1992, Zurich made a methadone available to users of heroin, and this methadone drug actually helped with the treatment. And Mark, who was specifically a person who gave an account of what he did during 1992 Zurich heroin as an addict, he said he got therapy and found housing with a social project in Zurich, and he said that those programs have helped him tremendously. He said it not only got people off the street, but it also significantly decreased the amount of people taking heroin, especially considering heroin on the street can contain a lot of other substances which will affect the body in a lot of different ways. So yeah, and Zurich became the first place in the world where therapy programs handed out heroin prescriptions to heavy and long-term opioid users for whom other substitutes didn't work. And what's really interesting is by 1995, many of the new policies showed success. The support system for these drug users increased, and drug addicts eventually started to work with police, social, medical services, and a lot of other cooperations. And eventually, the Zurich police shut down the last remaining drug camp in the heart of the city by 1997. Furthermore, in 1997, there was a public vote which actually helped the conservative Swiss Republic because they rejected the adoption of stricter drug policies, legitimizing the new, less punitive approach. And more specifically, which is later on in 2008, they finally voted to put the strategies into development into the Swiss law, which shows the major difference in the laws of Switzerland. They took more of a liberal approach. They took taking drugs into helping people, getting them into jobs by making them realise that they are a part of the society and they can get therapy and treatment instead of just being told that they're a criminal. Moving on, we're going to be talking about the four-pillar policy, which a lot of people would have heard of. So it's the Swiss fourfold approach. It's also called the pillar model. They have the four rules, which is prevention, treatment, harm reduction, and repression. I can't say it, but that's their approach, and the vision is towards the federal government, which is directing its efforts into reduction in the drug-related problems in Switzerland. The vision is to be implementing three goals, which is reducing the consumption of drugs, reducing the negative consequences for drug users, reducing the negative consequences for society as a whole. And I think that's what makes Switzerland such a special country, because they're trying to help the society. They're trying to help a lot of people that are taking drugs in a way that they know they're getting help, and not just taking them out of society completely and making them feel like they're not really involved. And in implementing its drug policy, the federal government will continue to base its global strategy on the four-pillar model, as I just told you guys about, and it's talking about the four main things, which is prevention. Prevention helps to reduce drug consumption by making it harder to use drugs and by preventing the development of addiction. So we know that drugs are so on the rise, but also people are on the incline of taking more drugs if they are able to. So by preventing people, there's a noise in the background. By preventing people from actually getting the drugs, they will be able to prevent the development of addiction. Therefore, there will be a significant decrease in the number of people using drugs, which I think is quite clever because it overviews the policy in a greater and more wider way. And then it's therapy, which is a part of treatment, and this is to reduce the drug consumption by enabling users to break free of the dependency and to stay free of it, or at least by keeping this option open to them, because they're able to understand that they have someone that helps them socially. There is someone that helps them treat the possible issues that they are facing right now. And in addition to this, there's a social integration of those under treatment, and the treatment can also improve their health in ways that they weren't expecting, which is the best part about it. And if we move on, we can talk about harm reduction, which is the third policy. That the harm reduction is to help reduce the negative consequences of drug use on the consumer and indirectly on the society as well, by providing individually tailored and socially less problematic ways of consuming drugs. So there's loads of ways of taking drugs, but if we're telling and understanding the consequences of them, people will be able to stop by even getting involved into drugs. And that's very important because educating a lot of people around the idea of drugs is so important. And then the last one is repression, which is by using law enforcement's appropriate regulatory measures to implement the prohibition of illegal drugs, and thus helping to reduce the negative consequences of drug taking for society as a whole. So these are the four pillars, and I think they are the main reason why there's been such a significant decline in the use of drugs in Switzerland. And I really do appreciate Switzerland's way of going around the situation, because they are understanding people and they're understanding drug users. They're not just telling them that you're a criminal and you should go in jail because you don't know how it works. They're trying to educate and prevent and also give therapy and also treat, but also use law enforcement to look at it as a whole consequence. So I'm going to move on and talk about the data, which is of showing of how has there been changes in Switzerland. So if you look at the data in the image, you can see that from 2012 to 2020, there hasn't been much. I wouldn't say there's been fluctuations, but there's not been a significant change with the drugs without rebate. But drugs with rebate has been an increase from 2012 to 2020. If we look quite specifically, it's been from a 2 to around 15, which is up by 13%. And if we're looking at it in more of a wider and specific way, it shows that the extent of drug use among older people remains lower. there's been data that shows peak of drug use has been seen mainly between 18 to 25-year-olds, and this is broadly the situation observed in countries like Switzerland. The extent of drug use among younger people, in particular past month prevalence, indicate of recent and regular use, which remains a lot higher than older people. However, lifetime prevalence, which is an indicator of the extent of exposure of the general population of drugs, remains much higher of However, lifetime prevalence, which is an indicator of the extent of the exposure of the general population to drugs, remains high among older people than among younger people for the use of substances, which is obvious because younger people have just been introduced into it. However, older people have had a lot more exposure around it from a longer period of time. And conversely, the use of substances that have emerged more recently or have infiltrated certain lifestyles are reportedly much higher than young people. So there's obviously a lot of debate around who uses it more, but if you look at it in two different perspectives, there's two lights on it, which is who's been using it for longer, but who uses it more. And it is quite obviously not one or the either. It just shows that in general, people have been using drugs. And one very specific example is ecstasy, which has a lower lifetime use and hardly any current use among older people, but high levels of use among younger people. This could also be because ecstasy leads to a shorter lifetime as well, so maybe that's another reason why there's data around like that. But yeah. Moving on to talking about, in general, about Switzerland, they have released a lot of campaigns called Swiss Federal Council to introduce compulsory licensing of an instrument which allows cheaper and a more easier way for the government to deal with the situation of drugs. So what they've done is they've actually told people, like, we're going to have any drugs given to the people around the pharmaceutical companies to be checked before by the Swiss government if they are safe or not. And which is why it's so responsible, and there has been fluctuations in the number of use, but also the access for people, because a lot of heroin addicts were actually given certain drugs which in Switzerland which help them kind of cope with without being with heroin that they got off the streets. These drugs were licensed, and Switzerland actually made them suitable for the drug users in a way that they could actually get help. And that's what makes it so eye-opening, because Switzerland took a chance to actually make a specific company to help with the pharmaceutical designing of drugs which can help drug users. And it's licensed, which makes Swiss healthcare so inspiring, especially for other countries, because there's been a change and there's campaigns for all sorts of people. And I think that was really interesting. But if you look at an overall perspective, drug harm reduction has taken a major take in Switzerland with a lot less users. And I was reading a article in which it talked about how there's been a major change in Switzerland, because people that were using drugs in other countries still went back to it. There were certain people that were put into jail for using drugs or selling drugs, but they went back to using drugs. But in Switzerland, therapy and treatment really changed the people's opinion, and they weren't as likely as going back to drugs. And that's what makes Switzerland such an inspiring country with the way they deal with drug harm reduction. I hope you enjoyed listening to my presentation. And thank you for this really interesting SSC that we did, because I think it gave me a chance to understand what really goes on around the world in the way drugs are used, the way people are trying to combat the stigma and persona around drugs and what people view as drugs. Why do people take drugs? I did not know this, but coming to this SSC gave me a real experience of what it is actually like, and that's why I really enjoyed it. Thank you so much, and thank you for listening.